Very difficult to tell at the moment, but given that it's not that far away on the other side of the border, I'd expect it to arrive soon. As I say, I find it very hard to be able to say whether it's this week, next week or next month.
Is Gibraltar ready for this virus? And I don't just mean the GHA and the authorities, but I also mean the public. Does the public know enough about what they need to do to prevent the spread of this illness?
I suppose the short answer is we'll never be ready. You can never communicate with everyone perfectly. We've started to communicate with the public, but there's an awful lot we still need to do.
What is the real risk of catching the coronavirus, given that it is quite similar to the common cold? What's the real risk here?
I think the risk for most people is that they'll get a bad bout of cold. It's only the people that are 70 years and older that have any reason to be concerned. So I think especially our children, they're going to catch it, they're going to run around, they may not even know they've got the virus, and that's true for the vast majority of people. So the real risk is for the elderly.
Where should we be in terms of preventing this virus from spreading? What should we be doing here?
I've always been consistent. We are going to get the virus here and it's going to spread. I'm also convinced, given the Mediterranean love we have of each other, that it'll spread quite widely. What I can't tell you is how quickly it'll spread. Ideally, we would want to delay its spread. Why would we want to delay its spread? Because we don't want absolutely everybody to fall ill at the same time. If that happens, then when people want to go to hospital, our staff will be ill. And it just makes sense for us to try to delay its spread, not to stop its spread, but to delay its spread.
How are you getting that information, that advice out to the public?
We are about to launch a couple of campaigns. I've seen the paperwork over the weekend, and we will send them out through social media using the TV and radio. Two streams of thought. One is self-care. We have a population certainly that wants and craves medical attention and care, which isn't always an unalloyed good. And then the other one is for the social distancing that I'm talking about. The care and attention we give to people is based on how much we protect them from the risk of infection.
Well, given the small community and everyone lives in very close proximity to one another, and we're a very touchy-feely community as well, lots of hugging and kissing, is a risk possibly that it could spread faster in a small place like Gibraltar than anywhere else?
Absolutely. The Diamond Princess illustrates just what happens when you've got people living in dense, high-density populations who are, as you say, touchy-feely. It's a very Mediterranean thing. I think it's absolutely marvellous that people love and care for each other, but it's exactly the wrong thing to do with an infectious disease because we transmit and spread it. So my advice has been very consistently, we're going to have to increase the social space between people. I would encourage people not to shake hands. I would encourage people not to kiss. I would encourage people to religiously wash their hands. That's the best way you can protect yourself and also protect the elderly.
Well, let's just talk about the elderly for a moment. The government has issued a press release today giving some advice, and we of course saw your memorandum that you issued internally within the GHA with advice that you were given, and it's quite drastic, some of the measures that you're suggesting, in that young children who themselves may not be harmed by the virus but could potentially be carriers. You're suggesting that young children stay away from their grandparents and vice versa.
It's an act of love. If you really care for your grandparents or your great-grandparents, you don't want to give them something that might cause them harm. So whilst we love and kiss and hug everyone because we're showing our love, at this time it's the wrong thing to do. So I would certainly recommend to people to create that space. That's a sign of love and affection.
So we're talking about, for example, Sunday lunches with the family to perhaps reduce those. Grandparents who pick up their grandchildren from schools, perhaps they need to make alternative arrangements. Are we talking about that sort of draconian measure?
It's not draconian. I think we have to account for the fact that we've got an infection that loves to jump between people. And, bottom line, as I say, is that we want to help the people, the wiser people amongst us, the people that have earned their white hair. We need to, and want to show affection to them and our love. And therefore, I think people need to make the adjustments that they see fit. There are over 36 people at the moment in Gibraltar who are in self-isolation. That's a sacrifice they've made for Gibraltar, and it's the same sort of thing.
Okay, let's just have a look at the hospital and see how well the hospital is prepared. For example, face masks, oxygen, ventilation equipment. I mean, how well stocked are you with those things?
I always work on the basis of plan for the worst and hope for the best. I think we've actually got not bad stocks. I wouldn't wish that I'd said this, but because of Brexit planning, we've got more stocks than we would normally have. We've ordered some more ventilators to top up our supply, and other equipment. Well, we've got a brand new oxygen plant that I think has just been installed or is in the process of being installed that will give us our own independent supply of oxygen. So at the moment, we feel reasonably comfortable. There's always more things we want. The difficult point for us, most of these things are actually manufactured in China. So even if we wanted to, we couldn't necessarily get all the things that we wanted.
Are you referring perhaps to the testing equipment, which you said that we haven't been able to get into Gibraltar just yet?
Well, I would give credit to some of my colleagues who've worked really hard working with Public Health England to acquire some of the new testing equipment. It will be here, I hope, in the next 2 weeks. We need to train up our staff, and I hope we'll have our own independent facility to test here rather than in London by the end of March.
And how long at the moment is it taking to get test results?
I wish the results were available immediately. Unfortunately, it's taking too long, maybe sometimes as long as 4 or 5 days. We have to fly it to London. It has to be processed in London. The lab there at the moment is inundated, so it's taking 2 days for that to be done. I've explored all kinds of other options, but the one in Colindale, which is in northwest London, is the best option for us.
Given what you know about this virus, and given what you know about the small community that is Gibraltar, how many cases of coronavirus are you expecting to see here on the Rock?
Very difficult to tell. People have talked about this being a global pandemic and that 60 to 80% of the world's population will get it. I'm comfortable with that prediction. And I think for the vast majority of people, we're going to get used to this infection as if it's the common cold.
So most of us will get it?
I would say in a close community such as Gibraltar, I'd say that nearly everybody will at some point get it.
Okay, let me just go back to the hospital and ask you about what you have in terms of an isolation ward. I mean, will the hospital be able to cope if you do get, a large amount of people coming down with a severe case at any one time?
We're moving people around. We're trying to create extra space in the hospital to be able to take more people and to deal with more people. Actually, at the moment, my concern is more about staff numbers, particularly if there are issues. But a lot of them live in Spain, so there's no point in having beds if you've got no one to look after them. So,
well, what contingency measures are you making in terms of replacing the staff?
So we are recruiting people from other places. The problem, I think, particularly around nursing staff, is it's a bit more of a challenge there. We've basically exploited nearly all the avenues we have, and you can't suddenly grow a staff nurse overnight either.
So it's possible that we will have a staff shortage at the hospital?
I think that we will cope and we will reorganise ourselves, and there are other ways of providing care. So, for example, cohort nursing is one of the things they're introducing in the UK, which means that you need fewer staff to look after people, and that's certainly something that we'd be looking at.
Do you think the public really understands what self-isolation means? Because I might self-isolate at home, but I live at home with other people. they may have contact with me and then go out into the community. So what exactly does self-isolation mean?
So what we mustn't do is confuse quarantine from self-isolation. If you quarantine someone, you know they have an infection and you're trying to avoid them passing it on to anyone else. With self-isolation, what we have is a risk that someone might have picked up the virus. They haven't picked it up and we've got no proof that they've picked it up, and we're relying on the symptoms to determine whether they're possibly carrying the virus, but there's no evidence that they have the virus itself except for where they have come from. So if you happen to be sharing a house with someone who is only at a slightly higher risk than yourself, then actually you've got even less risk. You've got a higher risk but not a huge amount of risk. So it's based on a risk assessment, managing the risk of that care. And so when people do go into self-isolation, we do give them advice, Public Health England's advice, in fact, in terms of having enough of a social space, using your own towels, using your own cutlery, how you should use the toilet, for example. So you shouldn't necessarily be mixing with the other people in your house as much as possible.
Well, you took a phone call a few moments ago from the airport. They're in constant contact with you with regards people arriving from at-risk countries. And there were reports last week that one older couple were picked up in a prison van. I mean, is that the sort of measures that we have in place? Is that going to change?
That was regrettable. I really apologise for that incident. Sorry to that couple particularly. Unfortunately, at short notice, we had to come up with a vehicle that allowed the driver to be safe whilst moving a passenger. It was the only vehicle that was available in Gib at the time. Obviously, when people report at the border, the frontier, the airport and the port, we ask them to make their way to a place where they live, and we ask them to avoid coming through public transport for obvious reasons, and sometimes, nor can they take a taxi. So this was the only way we could come up with at short notice. There aren't a huge number of vehicles. We went to St John's Ambulance, for example, for transportation, and the problem is the driver sits with the passenger. So if we're really trying to reduce the risk, that was the best we were able to come up with at the time.
So we could use those measures again then, if that's the best option that we have?
At the moment, that's our best option. I regret that, but that's the only option we've got.
Some people are saying they're having difficulty getting hold of hand sanitizers at the shops. Are you aware of any of these reports?
I think if I gave the impression I knew everything, I'd be telling a lie. So I don't really know how well they're stocked. And actually, in many ways, that's the business's own decision about where they get the supplies for and how well supplied they are.
Okay, one final question. You just mentioned you don't know everything, but I am going to ask you a difficult question. How long can we see this wave of coronavirus lasting? How long will we have to have these special measures in place?
That's $1 million question. I wish I knew the answer to that, because I'd be rich. It very much depends on how quickly it spreads in our population, and whether it comes in 1 or 2 or 3 waves, because sometimes these viruses come and go in waves. I wish I had the answer. My assumptions are that it will spread very rapidly in our population because we live in very densely populated areas and we have intense relationships with each other. So it could happen quickly, it could take a long time, but I don't know.
And if we've had coronavirus once, will we build up an immunity to it, or is it likely you could also get it again?
The evidence is that the virus is not changing, which means that the immunity you require once you've been infected will last you a lifetime. But of course, coronaviruses over a period of time can change. About 25% of colds are caused by coronaviruses, and the reason we get them every year is they change. At the moment, we can't predict what will happen exactly. We need to get through the first wave of the coronavirus to see what's happened, but the genetic analysis that's been carried out shows that it's very, very stable.
Let's just talk about some of these preventative measures. Hand sanitizers, do they work? Face masks?
Okay, so hand sanitizers do work, but you need 70% alcohol in them. And I have said to people when they've been able to get hold of them in the shops to top them up with alcohol. Rubbing alcohol will do, but if you're desperate, gin or vodka will do just as well, as long as you don't drink it. So you want 70% alcohol in your gels. In terms of masks, the purpose of a mask is to filter out the air that you breathe. Hopefully it catches the virus. But as anyone's been abroad in the cold country will know, our air is the air we breathe out is full of water. So the mask becomes saturated with water and it stops working. So the main purpose of a mask immediately after the first 10 minutes is to avoid you touching your face. And the other main function of a mask is to stop you infecting other people. So the reality is you should wear a mask if you have got a cough, if you're sneezing and you don't want to give other people it. But don't wear a mask because it makes you feel like you're protected, because you're not. Hand washing is the most effective way. The virus stays on surfaces. It can stay on surfaces for 3 to 5 days. You can get rid of it by simply washing with detergent and ordinary cleaners, but you can pick it up and then you touch your face and you can pass it on to yourself. So hand washing, especially on knobs and buttons, door handles, tables, that sort of thing. Make sure the environment is clean. That's the best way you can protect yourself, and wash your hands frequently and often.